Good afternoon, and welcome to today's event, State of Impact Social Capital. Today's speakers are Impact Genome CEO, Jason Saul, MassMutual Foundation President, Dennis Duquette, Impact Genome Vice President of Evidence and Implementation, Dr. Heather King, and Impact Genome Vice President of Data and Analytics, Chris Deere. Today's event will last approximately 36 minutes with time for Q&A. You can submit questions via the chat box. As a reminder, today's presentation is being recorded and we will share the presentation and deck with you after the event. And with that, I will hand it over to Jason.
Thank you. We're excited to share with you our latest findings from the Impact Genome Project on social capital in America. Social capital is a complex term. And on some level, the easiest way to explain it is why we're all here today. Social capital is how we got to know each other. It's how you showed up to this webinar. It's the relationships we have through LinkedIn, our friends from college, the connections we have at work, the way in which we get our jobs. It is the glue that drives a lot of the social outcomes that all of us experience. And today we're going to unpack social capital, explain to you how it happens, why it works, and what are some of the organizations doing that are actually driving social capital. So on the next slide, I really want to talk to you about starting with what the Impact Genome Project really does. In a word, we really crack the code on social impact. We explain how it works. And the only way to do that is by creating standardized data. It's much like what the Human Genome Project does for biology or for medicine or for genetics, or what something like Pandora's Music Genome Project does for listening. It creates a standard set of elements that allows you to compare things, to predict things, and to be able to aggregate and synthesize information. The way we use the Impact Genome Project is to be able to help people make better decisions about social impact. In order to do that, first, we have to understand what people really need. So in terms of social capital, how many people have it? How many people don't? What do they actually need to get social capital, and how much does it really matter to them? On the other side, that's the demand side, if you will. On the other side, we need to be able to use data to figure out which nonprofits are able to help create interventions to deliver social capital. How can we help people who are marginalized, who don't have those fancy connections or LinkedIn profiles and can't find the resources they need to be able to get ahead in society? Third, we can use data now to be able to connect supply and demand, to connect funders to nonprofits to invest in what works. And that is the underlying purpose of the Impact Genome, which is ultimately to help allocate resources more efficiently so we can solve social problems. This year, we're focusing on what we call the Sentinel Outcomes Initiative. What that means is there's about 132 different social outcomes of things we could be doing in society. Mental health, domestic violence, prisoner reentry programs, graduation rates, job training. But when we really zeroed in on the things that were the most economically vital outcomes to society, the things that governments are focused on and that major funders are focused on to drive stability and economic vitality, it comes down to what we call the 6 key social determinants of health. And today we're going to be focusing on social capital. I'm going to hand it over now to Dennis Duquette, who's going to talk to us about why social capital really matters. And before I hand it to Dennis, I just want to say that the leadership that MassMutual and Dennis provided is more than just sponsorship. The insight to realize that social capital is an underlying explainer of social change is so powerful. And in fact, social capital really hasn't been measured in this country in the last 15 years. There was a study in 2000, another study in 2006, but this is the first national definitive study on social capital in about 15 years. And we're really honored that MassMutual has supported that and enabled us to bring you this data today. So Dennis, over to you.
Jason, thank you, and thank you for that very generous introduction. You know, and on behalf of the MassMutual Foundation and our board of directors, we are just so delighted to be part of this work. And it's really seminal to the work of the MassMutual Foundation and what we do. Our mission is all about activating connections and untapped opportunities within communities so that every family can build its financial capability and thrive. And so, you know, we use that as sort of the basis for our signature platform, which we call the MassMutual Project. The MassMutual Project was organized and launched in 2018. And very early into this work, it became very apparent that in trying to build financial capability in communities that are struggling, there's this social connectivity component that's missing. And so the whole notion of social capital and connectedness that we talk about in our mission really drives to the notion of social capital and how important it is. And this work has been really great and very natural for us because it's really derivative of our company's philosophy and how our company was founded. MassMutual was founded 150 years ago in Springfield, Massachusetts, when 31 individuals came together and pooled their resources in order to protect one another in the event of some catastrophic event that might occur to one of the families in the community. And from that conglomeration of people, MassMutual was born 150 years ago. We pull that through even to this day when we talk about Living Mutual, and certainly through the MassMutual Project. It's really important for social connections to be apparent, and we found in our work very early on that some of the most basic things that we take for granted in terms of connections within our community, connections with one another, connections with services that help us and our families thrive, did not exist in a lot of these struggling communities. So it really became our marching orders to not only focus on things that build financial capability and financial resilience, but in order to get that, you really have to focus on the social connectivity within that community as well, because that is very vital to this notion of financial stability down the road. And so this slide you see in front of you is really an illustration of the social capital side of the MassMutual Project and what is important to us. And again, this work is very, very important to us, but we know it's important to so many of you and so many others who aren't here today. So we're just very excited to be part of this. And I'll talk a little bit more about the MassMutual Project a little bit later. But for now, I'm going to turn it over to my colleague, Dr. Heather King.
Thanks so much, Dennis. Okay, so now that we know how important social capital is to all the other changes we want to see in the world, including financial stability and some of the other Sentinel outcomes that Jason mentioned, let's now talk about what social capital is exactly. So I think we've all heard the phrase, it's not what you know, it's who you know. And that's basically what social capital is. It's the connections that you have. And it's not just professional connections, it's also your friends, your neighbors, other community members. It's all part of your social capital. And they're the people that you can call on for help when you need it, and you give them help when they need it too. So you might be thinking, how could you measure something like social capital? Isn't that really complex? It turns out that you can measure it, and we can break it into 4 discrete outcomes, which I'm showing here on the slide. And these include the who you know, so that's that first one, access to personal and professional networks, but also whether you leverage those connections and use those networks. So that's really important distinction there. It's not just who you know, but also whether you can get help from them, and that's the difference between those 2 outcomes. Then we have navigating institutions. So that's whether you can get help navigating those key institutions like the financial system, the healthcare system, or the justice system to get what you need. And then whether you're civically engaged in your community. And again, it's really important to have all of these. So some are at the level of your own personal or professional spheres. And again, it's not enough to know people, you have to be able to leverage those connections. And the other 2 are more about the broader community. So for navigating institutions, it's about making connections with people in those systems that can help down the road, because we know that these systems are large, complex things. And especially if we're talking about the people that need the most help, it's unlikely that they're going to have the time and bandwidth to do the kind of research that would be required to navigate those systems and get the most out of them. So having somebody to help you do that is really important. And then the civic engagement outcome, it's pretty straightforward. It's about connecting to others in your community and working together to address those issues that affect everybody. So we need these precise outcomes so we can better diagnose the need and the solution. And it's the difference between a doctor telling you that you have heart problems and that you have coronary artery disease. So like just knowing that you have heart problems can help you get a general sense of what's going on, but having the precise diagnosis means that you can get a precise treatment. And that's really important, even in this space. So now we're on the same page about what social capital is and why it's important to be specific about it. So we're going to go through the need on the ground and what that means for the field. Okay, so we recently conducted a nationally representative survey in collaboration with NORC at University of Chicago and the Associated Press. And as Jason mentioned, the idea was to follow up on some of these studies that have been done, more than a decade ago, to understand what is the need for social capital outcomes in American adults right now. And so we found that while many have close connections they can rely on, a significant portion, so 13% or nearly 32 million Americans, have just one or no trustworthy person they can get help from in both their personal and professional networks. So that means that more than 1 in 10 Americans may not have somebody to go to ask for help for a personal issue or with a professional problem. And then here we're seeing the breakdown for the personal and professional networks. So 46 million have no one or just one person to turn to for personal help. And the same is true for 49 million regarding their professional networks. So we also learned that just having connections doesn't mean that you can always get the help you need. So again, this is why we need to be really precise in the outcomes that we're measuring, because having the connections and being able to use them are two different things. So 12 and 29% said that they rarely or never got the help that they asked for in personal and professional settings, respectively. So that's quite a lot. For professional settings, that's like 1 in 3 people. So similarly, respondents experienced barriers navigating institutions. So 38 million Americans need support from institutions, but were unable to access them. And if this was over the past year, so if we're thinking about COVID and everything that's been happening, I think that's a pretty significant number of people that were not able to get the help they need in a time that's been really tough. And 17% of them said that not having somebody to help them was a huge barrier. So again, having that connection to be able to navigate institutions and really leverage them and maximize the benefits is critically important. And then if you zoom out to the community level, you see that only about half of Americans are civically engaged and about half are not participating in any formal civic groups. And these numbers don't look the same for everybody. So we see disparities by race, income, and educational attainment across all of these dimensions of social capital. But let's just take access to personal and professional networks as an example. So 18% of Americans have one or no trustworthy person in their personal lives that they can call on for help. But if you look deeper at the breakdown by income, those below the poverty level are 2.5 times more likely to have no one to turn to for personal help compared to those above the poverty level. So that's not even like one person, that's nobody. When you look at race, you see these statistics double for Hispanic and Black adults. And when it comes to professional networks, over 20% of Americans have one or no person they can trust to help them connect to job opportunities. And this is true for 26% of white adults, but those numbers go up quite a bit for Black and Hispanic adults. And while this was just an example using the access to personal and professional networks outcome, we see similar trends across other dimensions of social capital. And overall, this is showing us the stark reality that many Americans need more and better ways to build social capital. So I'm going to turn it over to Chris Sear now, who's going to tell you more about the nonprofits that are helping people build their social capital and what that means for the field.
Thank you, Heather. Well, very few of these millions of Americans who need to build social capital on their own, can do it on their own. They need help. They need support and guidance. And many of them, there's many nonprofits out there who are built to provide these types of supports, and many are doing great work. In fact, Dennis will highlight some of them, specific ones later. But first, let's discuss whether there are enough of them to meet the need. By diving deep into the US nonprofit landscape, using the entire IRS 990 database, along with outcomes data that Impact Genome collects directly from nonprofits, we can understand that if as a field, as a nonprofit sector, are we well built to meet the need to help these millions of Americans? And the main takeaway is this: despite lots of programs doing great work, we have some work to do to right-size our capacity as a sector in order to step up and meet this need. First, let's start with where social capital work is being done today. Because social capital affects every aspect of our lives, building social capital is often wrapped into programs focused on other outcomes across education and public health and more. A young person needs a job, so let's connect them with a mentor as part of a job readiness training. A family needs to build financial security, so let's help them navigate buying a home. A veteran is experiencing depression. In addition to clinical supports, let's connect them with a local veterans network. But when we pull social capital out and acknowledge social capital as its own set of outcomes, what emerges are three critical priorities to address if we are going to have a healthy ecosystem that builds social capital for all Americans. First, on the next slide, when analyzing this massive data set of nonprofit programs, we find the vast majority of programs working to build social capital, nearly 80% of them, are focused on that who you know outcome, access to trustworthy networks. But as Heather mentioned earlier, individuals need all four outcomes to thrive. So priority number one is we need to ensure we have enough programs producing each outcome. Priority number two that emerges on the next slide is around resourcing. By quantifying nonprofit impact and then overlaying their budgets, we can calculate the average cost per outcome for each social capital outcome. Said another way, what's the typical cost for a nonprofit program to help someone build their social capital? We now know that it costs about $2,300 for a nonprofit program to help an individual build access to trustworthy networks, and double that, or $4,600, to help an individual build the behavior, build the muscle of using those networks. The behavior change outcome is more resource intensive, and thus it's more expensive. And these insights help us unlock the investment required to build social capital nationally. How? Well, let's just look at the outcome of access to trustworthy networks. Next slide, please. The Impact Genome AP NORC poll that was discussed earlier showed that nearly 32 million Americans need support to grow their networks. They need this outcome. At $2,300 cost per outcome, we need to invest $75 billion to solve this challenge. So is that a lot or not? For context, we estimate programs who work on this outcome to have a median program budget of about $50,000 annually, which means we would need nearly every one of the 1.7 million nonprofits in the US working on social capital to meet this need. And that's just for the one outcome alone. So what's probably more within reach is ensuring that existing programs are appropriately resourced to meet the need. But it's not just about resources. It's also about ensuring that every dollar has maximum impact, which leads us to our third priority for the sector, running programs that are built for success. That is funding what works based on the beneficiary and the context to produce these outcomes. By standardizing how social capital programs are built and looking for common strategies among the most successful programs, we can uncover guidance on how to best build programs or how to best screen programs for funding, and ensure that those dollars have the highest likelihood of producing results. To bring this to life, let's look at the strategy of using facilitators or mentors to share an identity with participants. This emerged from the analysis as an effective strategy when analyzing programs working to build access to trustworthy networks. Now, so what is that saying? Programs are more likely to be successful if facilitators share common characteristics with participants. This strategy has to be contextually relevant. So a program that's working maybe with young women of color may want to recruit other women of color to be their mentors. Or another program that works with Latinx entrepreneurs may ensure that their business coaches are bilingual and are from the local community. But what's important is that we need to build programs or screen programs using these types of strategies. If so, their likelihood of success goes up. And to be clear, there are more than 3 effective strategies. These are just examples. And the best strategies actually differ by outcome and by context. To dive in deeper, there's a link to a white paper at the bottom of the slide here, which has our full analysis. In summary, we don't currently have the capacity to meet social capital needs in America. We don't have enough nonprofits helping individuals build their social capital. And that's exactly why we're doing this work, to bring out these types of priorities, to ensure that we have enough programs focused on each outcome, to ensure that we resource those programs properly, and that we're investing in programs that are built for success. Later, we'll discuss how folks on this webinar can help support these priorities. But first, I'm going to turn it back to Dennis to talk about social capital in action.
Thanks, Chris, very much. You know, I was struck by that data point that Heather shared with us earlier about 38 million Americans who have resources available to them, but just don't know how to connect with them. That's something that we have seen time and time again in our work. And so, you know, social capital and the underpinnings of social capital informs our giving across our entire grant portfolio. But I want to talk about a specific example on the next slide. So we started, as I mentioned earlier, we launched our Live Mutual project in 2018, and one of the communities where we began was a community in Memphis, Tennessee called Fraser. And we happened to be in Memphis in 2017 for another reason. We were out doing an activation around our financial education program for kids, and happened to meet at that time, along with our general agent in that area, a woman named Linda Williams, who ran an organization called the RISE Foundation. And we really became taken with RISE and what they stand for. RISE stands for itself: responsibility, initiative, solutions, and empowerment, really focused on positive outcomes. But as we talked with her and talked with her organization and talked with other leaders in that community, we found that they were struggling around the area of connectivity and bringing the necessary resources to bear to help people move forward in their lives. And so we started early on with the RISE program and funding their Save Up program, which works with residents of that community and brings financial resources and financial education resources to bear in the community that residents prior to this program didn't know existed. And so they work with residents in order for them to build a set of financial goals and to help them build plans to reach those financial goals. And they've done so with quite a bit of success. I mean, last year in 2020, this organization helped 134 families buy their first homes, which is remarkable for this community. 139 families bought new vehicles so that they could get to and from work. This is a community where transportation and lack of public transportation is a very pronounced need. So we were really happy to see that improvement. 38 small businesses have been launched as a result of bringing resources to bear through the RISE Foundation and through their programs for people who have ideas about businesses. And this beautiful young woman that you see on this slide, her name is Akila, and that's her son. And she is someone that we have featured in our promotion of our work through the Live Mutual Project. She's a young entrepreneur and started a shoe business that is essentially a pop-up business that she brings around the greater Memphis area to show her shoes and sell her shoes to people, and in particular women throughout the community, and has been very successful. And so we would ask, to really dig in deeper a little bit more about Akila's story and what she's doing. You'll see the link there, livemutualproject.com. Please go and you can watch a short video about Akila and what she's been able to accomplish, and also more broadly how the Live Mutual Project and this notion of social connectivity within the Fraser community has helped that community. And you'll see how we're working it and bringing this work to other communities. Again, making those connections within the community so that residents can begin to move forward, not just get by, but to get ahead as well. You know, our hope really coming out of this is that now with all of this, we're building a common vocabulary around social capital that will really be able to make strides and help develop strategies that can really bring this vital community asset to bear and make it a reality in communities where it just hasn't existed prior to that. So if you're interested, we'll go to the next slide. Things that we would ask you to do. Check out, some of the coverage we've already gotten. There was an AP story that ran a few weeks ago, and it was about the NORC report that Heather mentioned earlier. And you can also access the NORC report itself and get a little more deeply involved in the data there. The day the story came out, it was actually mentioned by Stephen Colbert on his program that evening. So that was something we hadn't bargained for, but we were very happy to see that mention and really focusing on this whole notion of people feeling a lack of connection within their community and how that's a need that we need to address as Americans. And then lastly, as Chris mentioned a short time ago, there is the white paper that I think does a great job of boiling this down to information that is consumable and scalable to share and really promote with other people who are engaged in this work with you. So we'll go to the last slide. The other thing we would just say is, don't stop today. This is the beginning of a conversation that we're looking to have. And whether you're a funder, a nonprofit, or, from an agency that has other vested interests within the community, it's really important for you to join this movement and become part of this conversation with us. MassMutual Foundation is delighted to be here, and we've been so fortunate to have worked with the folks at the Impact Genome Project to do this work. but we really are interested in getting more of you involved and getting as many people involved as possible, because we've seen very, very quickly and more easily than we thought we would, that the ability to make these connections can happen faster when the right resources and the right people come together to help make it happen. Now I'll turn it back to Jason, who is going to lead us into Q&A and close up.
Great, thanks, Dennis. You know, in reflecting about what Dennis was talking about and what we've learned in this short period of time, if anybody wants to make the world better in a post-COVID way, it's not just about getting people access to food. It's not just about getting people access to healthcare. It's not about stabilizing people financially. It's not about getting people jobs. The predicate to all of those outcomes is social capital. It's the ability to empower people to acquire the resources and the tools and the status that they need. And so we invite all of you, regardless of whether you're interested in social determinants of health, workforce, employment, economic mobility, financial health. Social capital is a movement that we are trying to build by engaging you as funders and practitioners to learn together, to share best practices, to benchmark, to figure out what the latest evidence says, so that we can move the needle on the ground practically, tangibly for the people that are most in need, which are not the people with the fancy LinkedIn networks. It's the people who don't have any connections. And as Chris showed, there are lots of opportunities to move the needle, and we invite you to be part of the process. So I'm gonna hand it over to Mackenzie Magnus, who hasn't had a chance to share much with you, but she is the visionary behind a lot of this work. So Mackenzie, thank you for your leadership, and we look forward to you facilitating some questions.
Thank you, Jason. So if all the presenters can turn their cameras back on, we'll turn to the audience for questions. So again, please share those in the chat box and we'll bring those up in the last 10 minutes that we have. So to start, Dennis, we'd love to know a little bit more why the social capital work is so critically important now at this stage of the COVID-19 pandemic.
Sure, and and Jason alluded to this a moment ago. Everyone has talked about this, but we've seen firsthand that what the COVID crisis has done is really taken any challenge that exists within a community and turned the dial up to 11. I mean, it's really just been, the light has shone, particularly when we look during the COVID crisis, and now as we're moving into what we hope is the post-COVID crisis. First it was access to testing and people not knowing where they wanted to go. We have partners at the Boston Medical Center in Boston who are working diligently from day one to really get to the most marginalized communities in Greater Boston, for example, to get testing services available because people just did not know where to turn. And so we had a unique challenge at the MassMutual Foundation where we were making an effort to support programs that would provide access to services throughout COVID, and at the same time working with our grantees within our portfolio to support them to make sure that they could maintain capacity to deliver services. So COVID was something obviously that no one planned for, but it sure did it really did shine a light on the dearth of connectivity that exists, particularly in the communities that we're concerned with.
Yes, anyone else on the team want to add anything additionally? Okay, we'll jump to the next question. So we have a great question related to direct investment in people and the communities they care for. So this person is curious to learn more about non-programmatic approaches to recognizing the value that communities are sharing with their social capital. So there's a lot of under-recognized social capital in communities, especially communities of color, but resources remain an issue. So rather than assuming that those communities need help to build social capital and routing money to nonprofits, what about directly investing in people and the communities that they care for?
So I can speak to that. One of the things that we think is really important is using this common language that we've built with the Impact Genome Project to ask people directly what they need for that reason, because we know that there's different types of social capital, obviously, and there's different resources that people are connected to that they can share with each other. And it's much better and more straightforward and more efficient for everybody if we just ask the people what they need. They know what they need, and if what they need is, you know, direct financial payments, then that's something that could be provided by a nonprofit or program or funder. And so that's why, you know, we need a common language like this, because once we know what people need, we can then very easily connect that to the funders that are funding those things, to the nonprofits that are working on those things. And we're building this infrastructure to make those connections happen for everybody.
Thank
And
you, Heather.
I would just echo that. You know, what Heather said is precisely the type of approach that we're taking. We don't go into a community claiming to know the answers, even armed with our vocabulary and social capital. It's so important that you connect with people in that community, whether it's the community leaders, the residents themselves, and find out where do those gaps exist, and then figure out with them ways to close those gaps. And so that connection and that conversation with folks on the ground is essential.
In fact, I hate to add on, but Heather, there was a piece of data in the research that you found around connections across communities, across racial lines and other things. And one of the things that I do think is worth investigating further is that while communities may be aware of what they need and may know how to connect within their communities, there are limitations of people's networks and connectivity across boundaries and across both geographical and racial boundaries. Was there any interesting insights, Heather, from the research that you found around the diversity of people's social networks?
Yeah, so one thing we found was that I think the majority of people had connections that were close connections. So somebody that they would actually ask for help, not just somebody that they kind of knew, that went across income levels. So I think it was in this, don't quote me, 60–70% of people had their networks were pretty diverse in that way. And I think about half of Americans had also racially diverse networks. So there was some diversity there, but again, it's, you know, this is just the first step in understanding this. You know, if we know what the current state is, and to your point, Jason, if we know that folks need help in one type of connection or another, then that's what's going to allow us to provide those resources. So while there is some diversity, I think there's also some work to do.
Great, thank you. So this one's about funding and limited funding. So what can organizations do to increase social awareness for marginalized communities? What is the role of the ERGs?
I think you have us at ERGs, but maybe you can, Mackenzie, maybe you have some thoughts on that, given your experience with this.
Yeah, if that person who shared that wanted to say exactly what they mean by ERGs, I want to make sure I'm speaking to the right concept, so we'll come back to that question. And so let's talk a little bit more about the techniques or methods for helping people leverage the social capital that they already have. And so Heather, if you can speak a little bit more to the program strategies, that would be great.
Yeah, so as we touched on in the presentation, there were actually quite a few strategies that came out of our analysis as being likely to lead to outcomes. And one general thing I want to say about that is it's really important for this resource allocation issue that we're talking about, and investing in the programs that are most likely to be successful for different outcomes, and it's not one size fits all. And we've seen this over and over again, not just in social capital, we've seen this in education, in financial health, in youth development, all the areas that we've looked at. There's different strategies that are more likely to be effective for different outcomes. And so that's a big takeaway, I think, of this work too, is that we have to be really strategic about what we invest in, because it's not like, well, this program can just do everything. There could be programs like that. But if we're really careful, using, again, this common language to help suss out what's going on in this program, that can really help make sure that the investments that are being made are going to lead to the outcomes that we want. So that's definitely something I want everybody to think about as a takeaway from this presentation.
Great, and we have a lot of great questions coming in, so I just want to acknowledge that we may go a few minutes over. So again, the resources will be shared afterwards via email. We'll also be doing our next webinar in September on food security. So if you are unable to stick around for continued questions, we will hopefully see you then. And if not, we're going to go ahead and continue on. So the ERGs is employee resource groups. And so Dennis, I'd love to hear your perspective on really how you guys work to, get the word out with your employees as well as your network of organizations that you work with around what you can do to increase social capital.
Very, very timely question for us. And I think my colleagues from MassMutual who may be on the call for my team are probably chuckling because this is something we're actively working on. We call them BRGs, business resource groups. Other companies call them enterprise resource groups. But we have a very rich culture, BRG culture within MassMutual and a number of BRGs. And so we're actually working on this right now. We certainly have done I think a pretty good job, a very good job of socializing our strategy of the foundation, community responsibility, and the Live Mutual project, and what that's all about, and really have when possible, have deployed members of the community responsibility team with whom I work as liaisons to each BRG to sort of help guide them through conversations that they're having. So we can't always get them locked and in line with specific organizations that may be doing work germane to our strategy, but we can at least inform them for the time being on what is the best way for them to engage in the community that is helping, the particular sector that they care about. But I do see an opportunity, and I do think that we have some runway for that. So it involves, again, I think, ongoing collaboration. I have a great working relationship with our head of diversity, equity, inclusion, and we meet regularly and speak regularly just about our work in general, but then specifically we are addressing this BRG challenge at the moment.
Wonderful, thank you, Dennis. We'll do one more question and wrap up. So Chris, talk a little bit more about the benchmarks. So you made a comment on the different prices, but how do you anticipate that they change, particularly during the post-pandemic recovery?
Yeah, that's right. So the benchmark data is derived from looking at programs on the ground that are running annually and data that we collect from those programs about their impact. We look at the cost to run those programs. We look at the quality of the data they're able to collect, whatever that level of quality is, and we consider all those things when we aggregate and analyze and create benchmark prices. The intent of the benchmarks is really frankly, to put a data point in the hands of the nonprofit sector to say, here's what it actually costs, to change the conversation around funding from just, I want to run a program, here's how much it's going to cost, so please give me a grant of this amount, to say, if you want to produce 100 outcomes, here's the cost. You want to produce 200 outcomes, here's the cost. How much, do you value this outcome in this community, and let's work together to achieve the outcome through proper resourcing. Certainly, we've seen a lot of changes in a lot of sectors from the benchmarks over the past 12 months. The benchmarks are 3-year aggregation of data, and so the current benchmark prices are going to continue to evolve as the field continues to evolve. And we'll see as we continue our way through the pandemic and then see what the new normal is on the other side. I don't know if any of us can claim to know whether it's going to go back exactly to what it was before, or whether the dynamics that influence price, whether it be program design, whether it be the ability to reach communities to provide programming, whether it be the changing need, is going to influence what the costs are. But we do collect this data in an ongoing way. It's not a one-time sort of, we just did this once and here's the benchmark prices. It's an ongoing, we update them every month based on the most recent data we collect. And so while I'm not a prognosticator, I'm not going to say I expect them to go up or go down or what have you. We do expect them to change, and we hope to work with the consortium and others, as Dennis and Jason mentioned earlier, to use the latest information to make better decisions.
All right, and with that, Heather, if you could wrap us up.
Yeah, thanks everybody so much for joining. This has been really awesome to hear your questions and have your involvement in this work with us. And we want to keep that conversation going. So we're going to be looking at food security next. This is the next in our Sentinel Outcome series. That's going to be in September of this year. We're going to have the same kind of data for you. We're going to be telling you what's the need on the ground, what's the nonprofit landscape, what are some strategies programs in the space are using, and how can you help. So please join us again in September.
Now we'll just add, this is Jason, for all of those who had questions that we couldn't answer or who have an interest, please join us, reach out to us, join our consortium. This is the purpose of the consortium, is to answer questions, to look at issues from different angles, and to be able to figure out how to solve the problem on the ground. So thanks to everyone for the panel. Thanks especially to Dennis and MassMutual, and we look forward to seeing you on the next call.
Thank you.